Hi there, my name's Mike Davis and I'm a chartered physiotherapist. I work in occupational health and I specialise in musculoskeletal symptoms. What this video will show is some exercise which you will be able to perform at home and using maybe a self-management program, and it's regarding knee osteoarthritis. So osteoarthritis is a degenerative condition which wears away at the actual cartilage which surrounds your joints. But again, obviously we're looking at knees, so it'll wear away at the cartilage, which makes your knee joint bend and maybe slightly rotate when you're walking, when you're running, even when you're jumping. So again, things like that potentially might be restricted at the moment. This can be caused through a variety of things, whether it's your lifestyle factors. It could be that the fact that you're overweight as well. It could be you've been in an injury, you could have been having surgery, or it could have been an accident. In general, over time, that surface of the cartilage actually just wears away. All right, and obviously that can cause pain as well, which obviously isn't great, because then you try to sort of think of things you can do. The one thing I would say though, after this video, if you've watched it and you've tried the exercise and the pain is still there, or there's still symptoms in your knee, then again, go to seek further medical investigations. That's through either your local GP or even through a registered chartered physiotherapist who will assess you fuller and then maybe be able to give you more of a specific types of exercise program. These exercises today are basically sort of general ones. Hopefully you'll be able to try to do these 2 to 3 times a week if you can, to start off with, gradually increasing them. Maybe start off with maybe 10, working yourself up to 30. But again, it is your responsibility that if you have got a bit of pain, then maybe just try to around the lower end of the repetitions and the higher end. Other good types of exercises to do for obviously knee osteoarthritis is things that are light load bearing. So anything maybe from cycling to swimming, even walking to an extent can help with the general mobility and keeping the strength within your knees. But the first ones we're going to try are going to be lying down, and these are sort of ones that maybe for your quadriceps. So if we're going to lie down, the quadriceps are the muscle that is sort of on the top of your leg. Okay, so what we're trying to do here is press down with your knee, pull your toes towards you, and then just press down. Okay, now these are actually sort of static exercises. So again, you can hold them for 10 to 30 seconds and then release. And then tighten up your quads again, pull your toes towards you, and then release again. Okay, and these are quite simple types of exercise that you can start. If you have any pain, obviously come off the actual movement itself and then just relax and then start again. The next type of exercise is a mobility one. So all you're trying to do is again contract your leg muscles, your quads and your hamstring, and gently pull your knee up towards you. So again, you're trying to pull your heel towards your bum and then slide it out again. Try and control this as you're going up and as you're going down. Try and control up and down. And again, see how you go with that. And again, just nice and fluid. Okay, if you do have any pain, and again, maybe make that movement a little bit smaller. Okay, so with that, okay, the next stage you're going to look at is if we can stand up. So we're going to do some stretching. Okay, so the stretching type of exercises that we're looking at, and again around the back and even around the front of your legs. So this is for your hamstring. So I've got obviously a step here, but you can use your stairs, you can use anything like that at all. And again, if you just place your heel actually on the step itself, and if you gently move forwards and bring your toes towards your nose, then again you'll feel a nice stretch down the back of your leg. If that's the case, then again just hold it there again for 10 seconds if you can, or longer. If you can't, and then sort of you can't straighten your leg, and that maybe you need to bend it and then still stretch forwards, that again is still stretching your hamstring as best you can, but try to get the stretch right at the back of your leg so you can feel it a little bit more. Okay, so these type of things will just help with the reduction of the tightness within the back of your leg and even the front of your leg as well, just by releasing. Okay, the next thing we're going to do, we're going to change a little bit. I'm going to sit down. Okay, now on this one you can use either a wrapped up towel, you can use a pillow, anything like that at all. I'm just going to use the inside of the foam roller. So all you're going to do is obviously sort of place that in between your knees, and all we're trying to do is squeeze. So as you can see, I'm trying to squeeze the roller in between my knees. You can use anything bigger as well if you get a little bit of a squeeze on. Try to just again relax as you come out, squeeze together, and then again, and then squeeze. Try and repeat this again 10 to 30 times, maybe starting off at the lower end than the higher end. Okay, so nice and easy, nice and gentle. All right, now please remember these are just the beginner type of exercises. You can increase these and you can add these into a self program if you go to the gym, anything like that at all. So the next ones I'm going to look at maybe a little bit later. So these are like sort of looking at a bit of strength exercises. And again, if there's any pain, please, sort of use your common sense when we're doing this. Again, we're going to lie down initially. Okay, so this time, as you're lying on your back, again, you can do this on the floor of, so your bedroom or your front room. We're taking the leg, which is the affected side, and we're going to go up and we're going to hold it. Okay, now this type of exercise, again, you're squeezing your thigh muscles, so the quadriceps and the hamstrings. You're bringing your toes towards your nose, and you may feel a little bit of tightness in your knee. You may feel a bit of pain. If that's the case, come off it a little bit. Again, try and hold it there. Once you've done that, just relax, take your knee down. But again, don't let your knee flop down. Take it nice and steady when you're doing that. And the same again, toes to your nose, nice and straight. Contract those, make them tight, your upper thigh. And again, just relax that down. Okay, keep that nice and fluid when we're doing things. Okay, from there, we're going to get up from that position. All right, and this is basically sort of again looking at leg strength and leg power, which we can go through. So again, we're going to use my bed here. You can use a chair or anything like that at all at home. You can use your sofa, but again, that's a little bit deep. All right. So what you're going to try to do is trying to sit down. Okay. Now the one thing from this is like a mini squat, but it's supported. All right. So try not to put your hand down on the bed or the chair. Cross your hands across if you want to. Fix your feet so that they're flat, and then just stand up. Okay. And again, you can just repeat that if you want to. Obviously, the higher your chair, then the easier it is. So if you lower the chair down, the harder it is. Okay. So again, I'd start off at this position here, and then work your way down as you go along and as you progress. Okay. So again, quite simple. Try and do 10 reps of that initially, leading up to maybe sort of 30. All right. And the next stage we're going to look at is stepping. Right. So this is something that we do during the day. So I'll just bring the step in. Going up and down the stairs, going off pavements when we walk in, sort of out when you're doing your shopping. All right. So all we're trying to do is as we come up onto the steps, so you'll lead with your bad leg, your affected leg. Okay. So as you come up, you put a bit of pressure on. As you come up, okay, you're not going to sort of push down or put your foot down unless it's painful, and then just step down on the other side. Okay. So as you can see, I'm putting a bit of weight there, but then what we're going to do then is just turn and then come back up. Again, try not to put your foot down. And again, go over the side. If you do need to put your foot down because it is painful, then again, you can come up, put your foot on, take it down, and do the same. Okay. If it is really painful, then obviously what you can do is take it back a stage, come up, go onto the step, go down, come down, and you're doing it that way. Okay. So there are different stages, but they're the type of things that again you need to try to progress onto. All right. And the next one again is just doing some little bits of squatting, all right, but standing up with weight bearing because of the weight bearing joint. So same thing again, put your hands on the wall, you can use a chair back, anything like that at all. And all you're going to do is put your hands so you're nice and steady, all right, if you don't have to do that, that's fine. And all you're going to do is just do some mini squats, all right. So again, trying to make your thighs nice and tight, your hamstrings nice and tight. You may feel it on your calves as well a little bit. So you can repeat it as I'm doing it, all right. So if we go from the side and the front, and again, so that's the front, so that's the way it's looking there, all right. But if you need to hold on to something, then again, obviously hold on to something to make it more stable, okay. Obviously you can repeat it, or as you go down, you can then hold it, all right. So that hold, again, will make the actual sort of exercise a little bit harder, and again, try to do that for 10, 20, 30 seconds if possible, okay. So they're the very sort of basic general things I would start off with, but like we said before, if the pain continues after 3 to 4 weeks, go to seek further medical investigations or advice through your local GP, or like I said before, make an appointment with an NHS physiotherapist to get an assessment. Okay, I hope that helps. There are other videos sort of on knees, so again, if it's arthritic things, then again think about if you don't like the exercise side of it, the cycling, the swimming, and there's even walking as well, if that's the minimum type of thing you can do. And start off quite small and then gradually work your way up, okay, and then see yourself progress, and hopefully then your symptoms will decrease. Okay, thanks for watching, take care, bye now.